Let's look at this study on PCOS. So you can see modulatory effects of alpha-lipoic acid, administration on insulin sensitivity, again, insulin regulating blood glucose, and obese PCOS patients. PCOS is Polycystic Ovarian Syndrome. What is Polycystic Ovarian Syndrome? In a nutshell, it's diabetes of the ovaries. You know, they call type 3 diabetes diabetes of the brain, but PCOS is a type of diabetes. It's affecting the ovaries. It's a major contributing factor to infertility problems in females, and miscarriages and other fertility issues. But what you can see here in this study, ALA administration significantly decreased insulin, glucose, BMI, and the HOMA index. And these are all markers of diabetes in essence. ALA integrative administration at a low dosage, this is again 400 milligrams daily, improved the metabolic impairment of all PCOS patients, especially in those with familiar diabetes who have a higher grade of risk of non-alcoholic fatty liver disease and predisposition to diabetes. So 400 milligrams a day of lipoic acid improved the blood glucose parameters and the weight of women, obese women with diabetes of their ovaries, PCOS. Okay, this next one is kind of a summary of multiple studies, again, all human trials, on alpha-lipoic acid as it relates to patients that are diabetics. And you see in this case, this is a research studies on patients, diabetic patients with neuropathy. So more on blood sugar, but in this case, particularly neuropathy. So you can see here in this first study, you've got diabetic patients with mild to moderate polyneuropathy, numbness, tingling, etc. This was a randomized, double-blind, placebo-controlled trial where they were giving 600 milligrams a day of alpha-lipoic acid or placebo, and this was a 4-year study. And so what did they find? They found a reduction of progression of neuropathy. So these patients did not have the same level of progression of their neuropathy. This next study in type 2 diabetic patients with symptomatic polyneuropathy, they gave 600 milligrams of alpha-lipoic acid 3 times a day. And that was in the phase 1 aspect of this trial. And what they find, the total symptom score decreased. So in other words, patients' neuropathy symptoms decreased. They felt better. They had improvements. They did phase 2 of this trial, 600 milligrams of ALL daily, and then had a withdrawal. And then they found that the symptoms decreased in the alpha-lipoic acid treated group as well, and improvements in neuropathic symptoms. So both arms of this study, or both phases of this study, effectively helpful. Then they did another one on diabetic patients with early nephropathy, that's kidney damage, and they used 600 milligrams a day for 8 weeks. And what they find? They found that it improved protein retention. That's what this is, a decline in urinary albumin. Albumin is a protein that comes out in the urine when the kidneys are damaged. And so in the case of giving people with nephropathy, kidney damage, which is a common side effect of diabetes, remember your kidneys go, and this is why so many diabetics end up on dialysis because of kidney damage caused by excessive blood glucose. But they found improvements in protein retention by the kidneys in these patients. They also found improvements in creatinine in a chemical called malondialdehyde, which is a free radical, and so which is used sometimes to measure potential for damage. And then they also found increased plasma SOD activity. What is SOD? SOD is superoxide dismutase. This is one of the most powerful antioxidant systems in the body. There's zinc and copper and manganese are minerals that help drive the function of superoxide dismutase. These 3 minerals are depleted by extra or excessive glucose. If alpha-lipoic acid is improving blood sugar, potentially it's improving retention and functionality of these three minerals to help with superoxide dismutase, and that's what they found in this research study. You can see here it also improved endothelium-dependent flow-mediated vasodilation and flexibility. So it enhanced the ability of blood vessels to dilate and for blood to flow. So improvements in blood flow. Then down here you can see in this last study, diabetic patients with neuropathy, 600 milligrams a day orally for 40 days, a reduction in neuropathic symptoms and a reduction in triglyceride levels. So if we look at all of these in totality, we've got improvements in neuropathy, improvements in blood sugar, improvements in kidney function, and reduction in insulin, reduction in blood glucose, reduction in hemoglobin A1C, as well as a reduction in triglycerides. Pretty profound effects when you're talking about, 600 milligrams of a supplement. There's not another drug that can really do all of those things in combination. Alpha-lipoic acid is not a drug. It's a natural thing that your body produces. Why doctors aren't recommending this more frequently is beyond me. Let's look at some additional research studies. So let's look at some of the other studies on lipoic acid and the use of treatment with the autoimmune neurological condition called multiple sclerosis. We've got a couple of them here. You can see here at 1,200 milligrams a day, this study was done. It was a double-blind randomized controlled trial, 12 weeks. Significant reduction in levels of inflammatory chemicals. So here we've got interferon gamma, intracellular adhesion molecule 1, transforming growth factor beta, and interleukin 4. These are what these are. If you've not heard of these are chemicals that when elevated signify inflammation, excessive inflammation. And it's that inflammation that creates the neurological damage associated with the progression of multiple sclerosis. So 1,200 milligrams of ALA reduced these inflammatory markers. We also see in the second study, 1,200 milligrams a day for 2 years, significant improvements in walking performance in patients. So it's not just that it's reducing, it's one thing to reduce cellular levels of measurable inflammation, but it's a completely different thing to actually improve an outcome in a patient's ability to function. And that's what this 2-year study showed, is significant, not small, but significant improvements in walking performance in patients. So let's talk about some additional studies. So schizophrenia, which is another condition, is not the same, obviously, as multiple sclerosis. Multiple sclerosis being an autoimmune disease of the central nervous system, whereas schizophrenia is an autoimmune inflammatory condition that affects the brain. And one of the side effects in schizophrenics is that a lot of antipsychotic medications cause diabetes. It's actually one of the side effects is that elevations in blood sugar and increases in weight. And so if you're been diagnosed with schizophrenia and you're on these types of medications, the likelihood of you developing diabetes and complications from that diabetes goes up as long as you're on those medications to treat your schizophrenia. So again, you're trading one illness for another by trying to treat the illness. And so we look at research studies on using alpha-lipoic acid in schizophrenic patients on antipsychotic drugs where they've had induced weight gain. So again, the drugs cause increased weight gain. What they did in this study, and this was, again, a double-blind placebo-controlled trial. It's a 12-week trial where they were giving 600 to 1,800 milligrams a day of lipoic acid or a placebo. And what did they find? A reduction in body weight and body mass index, so improvements there, that's good. They found significantly reduced visceral fat. So both a reduction in visceral fat and a reduction in total body weight just by taking alpha-lipoic acid. Again, this trial was not implementing exercise or other diet or lifestyle parameters, just using lipoic acid. Another study on schizophrenics used 100 milligrams a day orally for 4 months and found significant improvements in neurocognitive parameters. So in essence, these people, again, the functional outcome, it's kind of like what we're talking about with MS, where they walked better. In this case, they had better neurocognition. They could think more clearly. And in this study down here, 500 milligrams a day of lipoic acid, this was a 3-month study, significant increase in plasma adiponectin levels. What is adiponectin? It's a hormone released by fat cells that regulates things like inflammation. So it's very important. High levels of adiponectin are actually a good thing. We want to see increases in adiponectin because it helps improve blood flow and blood sugar. and energy utilization. But they also found decrease in fasting blood sugar or glucose and a decrease in something called aspartate aminotransferase. This is a liver enzyme. And one of the side effects of schizophrenic medications is liver damage. And so one of the things we know about ALA, lipoic acid preserves liver function. It protects the liver. It has a protective effect. And so again, in this trial in humans with schizophrenia, they found that it reduced liver damage 500 milligrams a day in a 3-month administration. So these are all, again, we're still on the compound on the nervous system, because schizophrenic being a neurological brain disorder, multiple sclerosis being neurological. We've talked about neuropathies, talked about diabetes. Now let's talk a little bit about another neurological condition, burning mouth syndrome. Now this is something, or scalding mouth syndrome, this is something that we see very commonly in people with mold toxicity, or even more specifically, not mold, but mycotoxin exposure. So mold produces mycotoxins. Mycotoxins are very similar in the way they create damage. They cause free radical damage within the body, and then that toxicity can sometimes lead to nerve damage. And we see it clinically, burning mouth syndrome, in a lot of people who've been mold exposed. So drawing that connection for you, because I want to show you something in just a moment. But in the studies, and there have been a number of them on people with burning mouth syndrome, and this is a review of randomized controlled trials. Here's what they found. Okay, so 9 studies. In most studies, lipoic acid was given at 600 to 800 milligrams a day. So this is, again, your dose with up to 2 months of follow-up. So 2 months of clinical follow-up. So they were watching these people. The majority of studies, 6 out of 9, so 6 out of the 9 research studies, showed that ALA was more effective in BMS patients, burning mouth syndrome patients, than in a placebo-controlled group, or in the placebo group. So the group they didn't give anything, they gave a placebo, versus the patients that they were giving lipoic acid. The patients with lipoic acid had improvements in burning mouth syndrome. Again, recognizing the mold toxicity and the mycotoxin toxicity, I also want to talk about a couple of other studies here. This one's not a human study. They haven't done human studies, to my knowledge, yet with lipoic acid and mold toxic poisoning. I've done a lot of this clinically, but I haven't seen any major human studies. But you can see here, protective efficacy of lipoic acid against aflatoxin B1 induced oxidative damage in the liver. What is aflatoxin B1? It's a type of mycotoxin. So going back to what we were just saying, mycotoxins, one of the hallmark symptoms that we see is burning mouth or scalding tongue syndrome with mycotoxin exposures. But what you can see here, alpha-lipoic acid is not only involved in energy metabolism, but also powerful antioxidant that can protect against liver oxidative stress induced by drugs, toxins, under various physiological and pathophysiological conditions. The toxins in this case being mycotoxins. What they found is that liver tissues were injured. They gave these animals aflatoxin B1 and injured their livers on purpose, and that damage was then alleviated by the addition of 300 milligrams per kilogram of lipoic acid. So they gave them liver damage on purpose by exposing them to aflatoxin B1, and then they found that the liver damage was alleviated or repaired as a result of utilizing lipoic acid. Now again, you can't always extrapolate an animal study to human studies. This, of course, done in broiler chicks, and there are many others that have been done, but this is where we start. We oftentimes start by looking at animals first. Now, there's a nice review paper by Sherry Rogers here on lipoic acid as a potential first agent for protection from mycotoxins and for the treatment of mycotoxicosis. So somebody being water damaged, building and being exposed to high levels of mold toxins. You see mycotoxins, toxic substances produced by fungi or molds, are capable of damaging multiple biochemical mechanisms, resulting in a variety of human symptoms, referred to collectively as mycotoxicosis. In fact, mycotoxins mimic xenobiotics. What are xenobiotics? These are chemicals that cause endocrine disruption in humans, not only with respect to their ultimate damage, but also in their routes of detoxification. So in essence, mycotoxins, a lot like xenobiotics in the way they're metabolized by humans and detoxified by humans. This suggests potential therapeutic options for the challenging treatment of mycotoxicosis. And so then they go on to discuss the potential role of lipoic acid. Now, one of the things that we see a lot in my practice is mycotoxin-induced nerve damage and muscle damage, liver damage, etc. And one of the hallmarks to what we use to help people, to support people's recovery is lipoic acid. And we use in our groups, we use 1,200 milligrams per day. And this is usually very effective. What we see a lot of times, just like what they see with the diabetics, with the neuropathy, well, mold toxins can also contribute to neuropathy. We see the burning tongues improving. We see the numbness, the tingling, and the loss of blood flow into the fingertips and toes improving as a result of using alpha-lipoic acid. So I'm not telling all of you who have been in mold that you need to go run out and treat yourself, but I just want to give you information that you can take with your doctor and work with your doctor to come to a better conclusion of what you can do. Knowledge is empowerment. Okay, let's talk next about some of the research studies and weight loss. This is the holy grail of what a lot of people want to try to accomplish is weight loss. So we look here at some of the trials on using lipoic acid in weight loss. So this trial was done in overweight, obese women aged 20 to 50. They gave 1,300 milligrams a day of EPA or 300 milligrams a day. So they were comparing EPA with ALA. EPA is a type of omega-3. But what they found in this group is, irregardless, the ALA-treated groups, the lipoic acid-treated groups had significantly higher body weight loss. So they experienced more weight loss than the groups that were just simply given omega-3 fatty acids. They also had a significantly attenuated decrease in leptin levels. Leptin is a very important hormone that regulates satiety and helps to promote weight loss. So they had improvements in leptin. So the leptin's high, we develop leptin resistance and we become resistant to weight loss. So when you have an attenuated decrease in leptin levels, that's a good thing, especially in people with high leptin. You can see down here in this one, again, overweight, obese women were giving alpha-lipoic acid. They found a high reduction in body weight, a reduction in BMI and fat mass. They found significant reduction in glucose levels for the control group with EPA and ALA group. And then this other study here, again, overweight, obese patients, 1,200 milligrams. This study was given over 8 weeks, significant reduction in body weight and waist circumference size. Another study here, obese individuals, 1,200 milligrams a day of ALA and vitamin E, and this was a 12-week study, significant improvement in serum adiponectin and interleukin-6 levels. Again, these are inflammatory markers that can improve. Remember, extra inflammation equals extra weight. In this study, it was 300 milligrams a day, 10-week duration, significant reduction in circulating levels of saturated fatty acid and total omega-6 fats. In this study, 300 milligrams a day, 10 weeks, significant reduction in BMI and fat mass in lipoic acid-treated groups. So lipoic acid obviously can help support weight loss. So what does the human research on lipoic acid say? Let's summarize a lot of this. Lower blood sugar, fasting, lower hemoglobin A1C, reduction in insulin, improvements in adiponectin, improvements in leptin, lowering of blood pressure, improvements in blood flow function by helping blood vessels dilate properly. We know that it improves functionality in multiple sclerosis patients. We know that lipoic acid has parameter impacts on schizophrenics being treated with anti-schizoaffective drugs. We know that it has improvements in people trying to lose weight. So all these wonderful potential impacts or effects.